I'm Aaron Weintraub, and this is Inside Kurdistan. So today I'm doing a very short lead-in because I have an interview with the Minister of Health, Saman Barzinji. There are a multitude of topics to discuss regarding health issues in Kurdistan, but we primarily focused on the dynamics between public and private healthcare and hospitals here, as well as the medicine availability here in both. We talked about wait lists in public hospitals, which is a huge issue here, and the availability of medicine for cancer treatment, for example, here. There's been a lot of developments and issues raised in the past few years in Kurdistan and Iraq, so I'm just going to say that if you're invested in the topic of health in the KRI, this is the interview you should listen to. So without further ado, Minister Barzinji. Minister Barzinji, thank you so much for joining me today.
Thanks so much for such interview.
I'd like to begin with COVID-19 because the pandemic is still happening, and I want to get into specifically the distribution of vaccines being available here, but because of misinformation and general reluctance from the population, what is being done by the Ministry of Health to make more people vaccinated before the fall comes?
Yes, thank you. You know, vaccination is the late measures that we started in the pandemic of COVID. We started before of the vaccination about more than 1 year with some measures, quarantine, isolation of the peoples, and some other preparation regarding preventive measures and curative measures. When we started with vaccination, first of all, we started with new legislation and criteria for peoples, how they can get, who will be more included in the risk groups that they have to take a vaccine. And later on, we changed it and upgrading the criteria gradually and accordingly. For now, vaccination is going and continue till now. But, everywhere in the world, there is some people reject to take the vaccine. It needs more health promotion and education. We already started and continue till now to educate and to explain for the people that it's a safe vaccine and it's for their health and it's a unique measure for now. It's an alternative measure for such previous measures that we did. We stopped the life, we stopped every movement and working schools, university. For now, not necessary for doing such measures. Vaccination is the unique measure that it's benefit, and we see in the last 2 waves that vaccination have a big role in the decreasing of the morbidity and mortality, even the severity. Mm-hmm. So, yes, it's true, but the progression and the achievements of the vaccination getting better in Kurdistan region.
What is the actual vaccination rate percentage in Kurdistan right now?
Really, it depends on the ages, but more than 40% of the peoples in general get vaccination 2 doses. But now we started with the 3rd dose of the vaccination as a rule in the world, and according to the WHO recommendation, till now we promote the peoples to take the last dose or booster dose, which is 3rd dose of the COVID-19 vaccine.
I want to talk about, in general, what this interview is going to cover is the differences between the public and private hospitals in Kurdistan. Because from what I can see and from the people I've spoken to, it seems like the public hospital system is reliant on the private hospital system. If there were no private hospitals in Kurdistan, there would be a health crisis. And what I'm curious about is what is being done to address a substantial public setup for the people here.
I think we cannot say that if there is no private hospital, public hospitals will going to be more crisis. No, it's a wrong, understanding for such issue. We can say private and public, it is both of them, they are complementary to each other. private, not in the health sector, even in every sectors now they have a big role in the world for providing the services for the people. Regarding health sector, private in the developed countries and in different models of the health systems, they have a role, more or less they have a role of because in Iraq, for us, as our situation, we have a very old-fashioned health system that have more social in the beginning of the establishing of the system in the Iraq. It was more social, and the world is changed. Globalization and private sectors came to the field. So we have to arranging the cooperation between public and private. I can say sharing between public and private, and isolation between public and private. Isolation in regarding of the human resources, not to be everybody working in both. To be one of them will be taking opportunity to get more jobs on others. And sharing to be for the people, it's not important. It's public hospital or private hospital. We have to, as a government, we have to provide health services for our peoples. So how we can changing? We started a health system reform in our cabinet of the government. We started with professional teams, international teams, that they have more experience about the changing and reforming of the systems of the health in the world. We started now to change the system, to arranging and reorganizing the health system. So I would like to give you some indicators about your question. Still, public is more dominant for the provision of the health system. I can say some of the health services or medical services till now, public hospital or governmental hospital, till now they are unique. There is no alternative. For example, for the emergency, most of the emergency cases, government will take and coverage the curative services. And for the burn and accidents, for renal dialysis, for cardiac intervention, for example, I am just discussing about the curative issue. If you are going to the primary health and preventive measure, completely 100% will provide by the governmental and public agency or facilities regarding primary health care services or primary healthcare programs. That's why till now public services more dominant on the private. However, as a government, we encourage and we enhance the private in a regulatory way, not to be in rubbish way, but we focusing on the public hospitals more than the private, because public will be for the peoples, especially for low socioeconomic peoples, and for such services that we have deficiency or we have no in the private sectors. So finally, I can give you an indicator. In the 2021, or more than 223,000 of operations under the general anesthesia done in Kurdistan region, just in the public hospitals. In comparison to the private hospitals, they have just about 69,000. So the difference is too big. In the percentage, we can say 76% of the operations done by the public, and the remaining 24% of the number of the operations done in the private hospital. So still public getting more responsibility for provision of the health services. Even in the corona, you started with COVID-19, a very low or very little numbers of the cases that they need ICU, intensive care unit, admitted a very limited number of the patients going to private. Most of them, they admitted already in the public hospital. So we cannot say till now private will be an alternative to the public.
It's more along the lines of, for example, if you need a specialized surgery or specialized care, and a major issue with the public hospitals here are the wait lists, the actual physical space of people being able to get treated here. And like you said, because of all of the public hospitals' requirements for assisting people here, what is being done to provide enough space for people here?
This is the problem that you mentioned, that we are suffering, really. It is related to the trust of the people. First of all, in everywhere in the world, nobody can stop the patients if they are going to private. They are free going to the private or where they will select the hospitals, even in the out countries. Sometimes in the developed countries, in the Europe, from one country, patients have right to go to another country or referring by another doctors or facilities to another hospital. So this is remaining about the trust of the patient first. Second, by itself, your question is an answer for our services. Whenever we have a large number of the waiting list for the operation, for example, or for some advanced specialized services, it means there is a lot on the public hospitals. That's why patients sometimes they have especially rich peoples and economically they can go into the private. They will go to be directly. Sometimes because of the privacy, especially some limited or specialized diseases. Some patients they don't like to go to the public hospitals, and they will go to the private hospital to take a private suite or rooms, especially among the women for the delivery or another causes of the people's going to the private. Sometimes people's need more hospitality and we can say hospitality of the they need special room or private regarding the hospitality may be more better than the public hospitals. They don't need to be remaining with others.
But these are for people who can afford this.
Yeah.
I'm talking about the people who can't.
Yeah, who can. We arranged new models in the Kurdistan region. We say it's semi-private health services.
Okay.
For example, instead of closing after the working time, closing of the operation room and the hospital, especially general hospital, I'm not meaning about the emergency room or emergency hospitals. General hospitals, after the waiting list, they have a big waiting list. Instead of closing the doors, we will opening in the afternoon and in the night to do semi-private with a symbolic prices of the money, and it will decrease the waiting list and patients they will be more satisfied, and we can also opening an opportunity for our doctor and staff to work more, and it will be an incentives for our staffs. So this is a solving of the problem. This is about the solution of the problem that we done. Also, we can strategically solving the waiting list. Waiting list is a problem everywhere. You know, in the UK, in Europe, when you need to do, it depends on the cases. Sometimes cold cases, no need to do more rapidly. But emergency services, it's 24 hours, day and night. They will do operations and intervention. But strategically, we have to expanding our services, increasing the number of the beds, hospital, and number of the operation theaters.
Yes.
Yeah.
So the semi-private model, when people pay to get services within this model, does that mean when they pay, even if it's a reduced amount, they're paying the government? Or are you doing it in collaboration with a private company?
No. It's not company. Directly from the patients can paying, but it's symbolic. For example, one maybe less than 1/5 of the prices of the private. So patient will be more satisfied if you are doing, for example, a tonsillectomy by $1,000 in the private hospitals. You can doing by $200.
But that $200 does go to the KRG.
Yeah, of course.
Okay.
It will distribute according to the financial
Okay.
financial regulations and not completely to the KRG.
Mhm.
It will mostly to the people's doing operations, staffs, doctors, and some of them as an income for the hostel, and a small percentage of them will be an income for the KRG. So it's something regulatory. We said semi-private services. In the Iraq, already they have such a model in different names. They will say private field or private services, private services. So they will specialize one of the hospital to be private even 24 hours. But for us, just after the working time, in order not to affect the public free services.
I want to ask for two different things. Actually, we're going to talk about this care in urban areas, and then we're going to talk about rural care in villages and smaller towns. But I want to talk about the safety of urban development with regards to health. For example, there have been links made towards electric generators possibly giving people cancer here. We have an enormous amount of development happening here in Erbil. I want to make sure that carcinogens and other health issues that develop from, for example, pollution from these development projects are being addressed by the Ministry of Health. What is the Ministry of Health doing to regulate these kinds of things?
It's not a rule of Ministry of Health alone. It is a comprehensive measure that will be done by every sector and every ministry, especially with Environment Agency in the Kurdistan region. And especially we announced our regulation and criteria for opening of the industry and any machinery or any operations that have more pollution or more disadvantage outcomes, that especially for the food safety and food security and for water supply in everything, not just for the cancer, in everything to be. We announced all the ministries. In the last months, we suffered from the cholera and diarrheal diseases that we have more experience about such cooperation between ministries. So it depends on the specialized services and specialized, especially for occupational health. And every industry and every services that opening officially, before getting the license of working, they have to get the Ministry of Health okay or license to decreasing the any hazards or any complications that will be an outcome of such services. Anyhow, it depends on the specialized workers if you are asking in general, but it need more health education also for our peoples. They have to know about the hazards of the some things and food safety and how to protect themselves from the pollution and from in the world corona was a big issue. You can take in consideration that our minds in the world regarding health ministries and all the governments going to take more consideration regarding preventive measures, not to just focusing on the curative and treatment and hospital. We have to take primary health care programs and preventive measures.
And to ask about rural areas, villages and farms and areas like that, what are the kinds of discrepancies that you see with Kurdish citizens receiving care in rural areas versus...
It's a very good question. Really, according to the headlines of our working programs in the 9th cabinet of the KRG, already mentioned about the equity of the health coverage to all the peoples, to all communities regarding inside the city center or in the rural area and urban and villages. So really we focused on such services. We tried our best to provide more medical equipment and infrastructures expanding and provision of more specialized services to rural area in order not to refer every patient to the city center and to decreasing the referral system of the patients. It's very important for opening an advanced centers and health facilities in the rural areas, especially in the districts that they have hospitals, to provide at least as more as possible to any health services according to our capacity. So it's very important because it's a unique equity of the coverage of the health services to all peoples with no any differences between peoples. It's important really, and we are continuing for such a program.
Specifically in Kurdistan, what kinds of problems are people facing in rural areas health-wise?
Some of the more advanced services, for example, intensive care unit, that they have some specialty. We have a shortage and deficiency in such human resources to provide as much as possible, and for some treatments of the oncological treatments, because they need a very special services. For example, LINAC radiotherapy you cannot provide in every district, and sometimes some specialized advanced operations, for example, open heart surgery, you cannot, even in the Europe, you cannot opening open heart surgery center in everywhere. You have to take the patients from different places and referring to the reference center. And some neurological accidents that they need neurosurgical operation. So for such people, they have to send to the reference center. But if you're asking about the primary healthcare programs in every district until the last village and on the border, we provide all the primary healthcare programs and curative and outpatient and chronic disease treatment and drug provision, and even for the renal dialysis we have in the districts. Most of the curative programs we provided already, but still it will remain some other advanced services.
To talk about advanced services, and you mentioned oncology centers, I wanted to talk about again, public and private pharmacies, actually. So there are a few things that are not sold in private pharmacies here that are very difficult to get in public pharmacies. For example, anti-cancer medicine, immunosuppressants, different kinds of hormonal treatment. It's different kinds of insulin, for example. Why are these not allowed to be sold in private pharmacies?
Really, drug profile is a difficult and complex profile in our working program. Really, we started reforming and rearranging the provision of the drug in the public and private, and we have more advanced achievements in such issue. If you're asking about the provision of the drug in general, it should be by Baghdad and Iraqi Ministry of Health, but unfortunately we cannot get more than 50% of our rights. That's why KRG will cover such gaps of the provision. Regarding the types of the drugs and supplements or any medical supplies, some of them, according to the Iraqi law and our legislation, it should be covering by governmental hospitals. For example, chemotherapy, one of the drug family that have been provided by the governmental hospital, vaccination, some anesthesia drugs, and some other biological agents. So that way, that's why more than 98% of the health services and chemotherapy treatments for the oncological cases or patients, they receive from governmental hospital because of different reasons. First of all, it's a very expensive drugs. People cannot get in the private. And also private sectors cannot tolerate to provide such expensive drugs to the patients. And patients can get in the oncological or cancer centers of our centers in the Kurdistan region. And also it is something like we have a foundation and charity in oncology charity foundation inside the Ministry of Health that get more funds from different resources and provide drug by a very strategic and big contractors with the companies and mother companies to provide such chemotherapy to our patients. Another causes of there is no chemotherapy, especially chemotherapy or vaccines in the private pharmacy, because already it needs more special regulations and measures that have be done in the quality control directorates for giving license for using in the private sectors, that private pharmacies cannot get such papers and measures, because chemotherapy is more specialized, and any chemotherapy and different chemotherapy specialized to special mother companies. So special mother companies, they cannot provide to the private because they have already contracts with the governmental ministries or in the Iraq and in Kurdistan region. So and also most of the drugs, I cannot say completely, but most of the drugs is already provided by the oncology centers. Patients no need to go to the private, because I will come back again to the prices. It's very expensive.
Mm-hmm. The companies that you're working with, where are these companies based? Can you list a few? Are they based out of Germany, Iran, India, United States?
It depends. I cannot specialize.
Let's focus on chemo.
No, there is no focus. It depends on the types and the number of the items they can provide.
Mm-hmm.
So different companies, different countries can have their representatives officially in the Iraq, and they can. But for us, our conditions, they have to have license and all our requirements and criteria. Otherwise, we cannot work or react with the companies that have no infrastructure or rules, and they cannot pass it our criteria.
Mm-hmm.
So it depends. Every countries, every companies, it's something like free market. If any company or mother companies can open their representative and provide their products to the Iraq or to Kurdistan region according to our regulation, it's okay. It's a free market. Nobody can stop them.
There are people who have low faith in medicine coming from certain countries, for example, India and Iran, as I listed before. And I spoke to a pharmacist yesterday who was talking about the quality of certain chemo drugs, for example, being lower than, for example, those that are made in Germany and America. Can you speak to that perception?
Really, I cannot say in specific country that the patients have more trust to the Germany, European or other countries or neighboring countries. I cannot say, because we have no specialized or a field survey or study on such trust or satisfaction of our patients. But in generally, I can say to you, and we recommend even in the media, in every we announce our people that they have to depend on the stickers and the quality control improvements of the any drugs when they will go to the market or getting any drug for their patients. They have to depend on the legal drugs. They have not to eat or to take any drugs, any supplement, any medical equipment that have not passed our quality control. How they can know? We have a sticker on the drugs. Any drug have a sticker, and we change the system of the sticker to an electronical coverage of all the drugs in Kurdistan region. We will start in the following weeks with a new system of the quality control electronically, putting a QR code on the any drugs, and people can be monitor also by themselves to any drugs. When they will get in the pharmacy, they know by their readings of their mobile or smart reading of the QR code, they know that it's official, it's okay, qualified or not. So it doesn't relate to the countries.
What is being done to make sure that, for example, if an Anfal victim needs to get chemo treatment for a tumor that they have, that person is able to get the anti-cancer medicine that they need in a public hospital near where they live?
For such people's chemical attack victims, especially, we can say as an example in Halabja, governorates, we have a specialized hospital just for such peoples, and already they have their own ID and get drugs, chronic drugs, not just for the oncology, even chronic disease drugs we can provide for them. And for getting a specific disease like oncology or cancer treatment or any others, we have a specialized center in Suleymaniye, in Arbil, in Duhok, and we plan to open also in Halabja. Already we opened a screening center for the breast carcinoma center in the Raparin district. So it depends on the patients. Patients can open their own profile in the centers of the oncology and getting drugs.
What happens if these drugs are not available in the hospital that they live near?
It depends on the types of the drug or types of the services. If it will be referred by the center to another center, especially for the reference center. You know, oncology is one of the health services that need reference centers, not just for the drug, even for the specialized doctors, for machine, and for most of the advanced services that have been done in the specialized reference centers, especially in the city centers. So patients have to be referring by doctors to such centers.
Well, thank you so much. I have one more question. When you were last sick, did you go to the hospital?
For me?
Yes.
Me and my family, every time we are going to the public and governmental hospital because I have more trust. Just again, I would like to explain to you, governmental hospitals have more criteria and more dominance because they have a large numbers of the doctors and different types of the doctor. And already they have trust in the Ministry of Higher Education also as centers for the training for postgraduate specialization. And also government will support the governmental hospital. In comparison, if you are going to the private is a private. It's something like business issue or business facility. So for me, I have a trust, and every patient, if they are calling me to select the hospitals, I recommend them to go to the governmental hospital.
Well, Minister, thank you so much for joining me.
Thank you so much for you. Thank you.
I'd like to thank Minister Barzinji for giving me his time and answers. Inside Kurdistan is brought to you by the Kurdistan Information Network. You can visit us at kurdistanin.net. Be sure to follow us on Apple or Spotify or wherever you listen to podcasts. And if you have any questions or comments on this episode or any other episode, reach out to us at info@kurdistanin.net. I've been Aaron Weintraub, and this has been Inside Kurdistan.